Now, as far as the physiology of the cardiovascular system is concerned, this session will be about a very important subject in cardiovascular physiology, what we refer to as cardiac output. And the subject is actually introduction to heart failure and introduction to the subject of arterial fibrillation. So from this point till the end of the course of the cardiovascular physiology, the subject is actually after remaining volume, which is the cardiac output. Because you will not be able to understand anything about heart failure if you don't understand cardiac output. That I would like to direct the attention of the students who are going to demonstrate the seminars and to pay very much attention. So the seminar is actually revolving around the subject of the cardiac output. And again, you cannot understand anything about the arterial blood pressure or the hypertension in clinical practice without understanding cardiac output. So this is actually, in a matter of fact, most of cardiovascular. The subject is very long. It cannot be covered in 2 hours. I don't know what we are going to do. It's a very long subject. 2 hours is actually not enough to cover the subject of cardiac output. Anyway, the subject will go as follows. Talk about the definition of cardiac output. What is actually meant by cardiac output. And how can we measure cardiac output with the measurement of cardiac output in clinical practice? You can measure it. You can measure the cardiac output. Then after that, you have the cornerstone of the subject is the control of cardiac output. The control of cardiac output. How cardiac output is controlled, you come to understand during this lecture that the cardiac output is actually heart rate multiplied by stroke volume. So logically speaking, that the control of the heart rate will be factors which are affecting heart rate and factors which are affecting stroke volume. Hopefully, we can finish today up to this point. That will be great. So you have factors that is affecting the heart rate and factors that affect the stroke volume. This is the control of cardiac output. Clinical practice and physiology, the application of the formula that cardiac output equals heart rate multiplied by stroke volume. Then after that, we'll talk about the ventricular function assessment. Is how to assess the ventricular function. The ventricular function assessment, or if you like, the ventricular function estimation. You have to say that the ventricle is working properly, or the ventricle is failing, that the patient is having heart failure, for example. So heart failure is the best clinical example to understand the cardiac output, and the cardiac output is the basis for understanding of heart. Now, we start, as you know that in the cardiovascular physiology, that you have the blood is coming back to the right side of the heart from different parts of the body. From all parts of the body, when the blood at the end of the day will reach either the superior vena cava for parts of the body above the level of the diaphragm, and the inferior vena cava for parts of the body below the level of the diaphragm. That blood is deoxygenated blood. It is deoxygenated. حتى لو عينت له في لونه تعرف طبعا. That blood is actually deoxygenated. Why is it deoxygenated blood? Because this blood is coming from different organs of the body at the end of the metabolic processes. So it carries the byproducts of metabolism. It carries the waste products of metabolism, particularly carbon dioxide. Then the blood entering the superior vena cava and the inferior vena cava. Then from the superior vena cava, the blood will go to the right atrium. This blood now reaching the right atrium through the superior vena cava and inferior vena cava from different parts of the body As you know from cardiovascular physiology, this blood is referred to as venous return. What is referred to as venous return. This blood is referred to as venous return. شو بالعربي العودة الوريدي. That's the blood which is coming back to the heart. From different parts of the body. Now we are in the right atrium. From the right atrium, this deoxygenated blood will go to the right ventricle. Right? Then from the right ventricle, the blood will be ejected through the pulmonary artery into the lungs. That is right ventricular cardiac output. That is right ventricular cardiac output باللغة العربية اسمه النتائج القلبية. Now the blood from the right atrium going to the right ventricle, from the right ventricle through the pulmonary artery, the blood is ejected from the right ventricle into the pulmonary artery going to the lung. That blood is actually from the right ventricle going to the lung is referred to as the right ventricular cardiac output. In the lung now, carbon dioxide will be removed, oxygen will be added, and that is the purpose of the respiratory physiology. In the lungs now, carbon dioxide is the byproduct of these metabolic processes now will be expelled to the outside, and oxygen will be added, and the blood will go now to the left atrium through what we refer to as the pulmonary veins. And then it reaches the left atrium. From the left atrium now the blood is oxygenated. That it carries oxygen. It carries oxygen. Now it would like to reach its destination of the different organs of the body, so how to supply these organs by means of oxygen to start the metabolic processes once more again. Then from the left atrium, the oxygenated blood will go to the left ventricle. Here will come the only exception, that the blood coming from the lungs into the pulmonary vein, and the pulmonary vein is the only vein in the body that is actually carrying oxygenated blood. Because normally the veins are carrying deoxygenated blood, and the exception on the other right side of the circulation, that the pulmonary artery is the only artery that carries deoxygenated blood. Now the blood in the left atrium, going to the left ventricle, then from the left ventricle, the blood is ejected into the aorta, and that is the left ventricular cardiac output. That is the left ventricular cardiac output. Then from the aorta, the blood will go to different arteries of the body, and at the end of the day will reach the capillaries, and from the capillaries by means of the exchange process between the intravascular and the interstitium, oxygen will be added and carbon dioxide will be removed, and the blood will go back to the venules, and then to the small veins, and then to the big veins, and then to the inferior vena cava or superior vena cava, back again to the right atrium, right ventricle, pulmonary artery, lung, to left atrium, left ventricle, aorta, and so on. The cycle will go on like this. So you are having here right ventricular output, and you have left ventricular cardiac output. If the heart is functioning normally, the heart is okay, then the volume of blood ejected by means of the heart should be equal to the volume of blood received by the heart during the venous rhythm. Isn't it? تمام ولا ما تمام؟ منطقي يقتضي هذا، مش كده؟ إذا كان القلب أصلا سليم، القلب سليم ماديا ومعنويا يعني سليم من كل حاجة، إذا كان القلب أصلا سليم معناته الكمية بتاعت الدم الداخلاله هتكون مساوية الكمية بتاعت الدم اللي شنوها؟ That will take us to the first point of the subject, is the definition of cardiac output. Having this introduction, now cardiac output, you have to put in consideration, you have right ventricular cardiac output and you have left ventricular cardiac output. That is why later on in heart failure, you have what we refer to as right ventricular failure, and you have also what we refer to as left ventricular failure. The two different instruments. When we say right ventricular failure, that means there is failure of the right ventricle, and the right ventricle is unable to